Between 2015 and 2017, something highly unusual happened to American life expectancy. For 3 consecutive years, it fell. We haven't seen a continuous drop like that since the 1918 flu pandemic. This decline was entirely unique to the United States. Other wealthy, industrialized nations saw their life expectancy continue to rise during that exact same period. When statisticians dug into the data to find out who was driving this massive drop, they found a very specific demographic: middle-aged white Americans. Nobel Prize-winning economist Angus Deaton was one of the first researchers to spot this alarming pattern. Working alongside his co-author, economist Anne Case, the two pioneered a massive investigation into this mortality crisis. The data revealed a deeply social phenomenon rather than a biological one. Understanding why these people were dying required looking far beyond the reach of standard medicine. Look at this chart mapping out life expectancy. The defining metric of this crisis turns out to be a bachelor's degree. For Americans with a college education, life expectancy is rising steadily. But for those without a degree, the line drops steeply, starting around 1999. Breaking down that non-degree group reveals 3 trajectories dragging the average down: drug overdoses, suicides, and alcoholic liver disease. Because these 3 causes of death are so tightly interwoven, Case and Deaton grouped them together under a single official term: deaths of despair. Working-class Americans are dying primarily by their own hands or their own habits. To understand what pushes a massive demographic to such extremes, we have to examine the engine of their daily lives: the American economy. In the late 20th century, automation and globalization began erasing millions of stable, blue-collar manufacturing jobs. At the exact same time, worker power collapsed. The robust unions that historically guaranteed collective bargaining and job security were systematically dismantled. The jobs that eventually replaced those unionized roles formed the modern gig and service economy. For non-college educated workers, this meant stagnant wages, unpredictable hours, and a complete lack of benefits. Eradicating those long-term manufacturing jobs stripped away income, certainly, but it also stripped away the cultural status, purpose, and dignity that historically anchored the American working class. This chart juxtaposes massive U.S. healthcare spending against flat working-class wages. We spend vastly more than other wealthy nations, yet get worse health outcomes. Researchers call this the Sheriff of Nottingham effect. The healthcare sector takes wealth from laborers, funneling it upward to corporate executives. When workers are hit with exorbitant monthly insurance premiums and surprise medical bills, it functions exactly like a private tax. It drains away the very limited resources they rely on to survive. The very system designed to heal the population is actively impoverishing them. It engineers a constant state of financial stress that acts as a direct trigger for despair. When economic stability vanishes, the social institutions built on top of it shatter alongside it. Marriage rates plummet, church attendance drops, civic participation disappears. Psychologists call this dislocation theory. It describes the severe psychological devastation that happens when individuals are entirely severed from their traditional identities and their social support networks. Those experiments illustrated how substance abuse functions as a desperate response to a barren, isolating environment, moving the focus away from a simple chemical hook. Today, the working-class American environment has been stripped of so much meaning, structure, and connection that it functions essentially as an empty cage. It leaves its inhabitants highly vulnerable to the temporary escape that chemicals provide. Pharmaceutical companies identified this specific, pained demographic and relentlessly marketed highly addictive opioids directly to them. Pharmaceutical exploitation accelerated the crisis, pouring gasoline on an already smoldering fire of economic and social isolation. Deaths of despair represent the fatal, predictable symptoms of a predatory economic system, shifting the blame away from individual moral choices. Distributing more medicine or building more clinics cannot solve this crisis alone. Society has to restructure the economy in a way that restores actual dignity and stability to non-college educated workers. The survival of the American working class depends entirely on rebuilding the social and economic habitat that was sold off for corporate profit.